Hello, everyone, and welcome. Today we are going to be discussing vocation as it relates to health science and some of the professions that you will be going into. So again, our goal here is to just kind of introduce the topic of vocation and kind of figure out how we can apply this to each of you individually, kind of based on what your career goals are within the realm of health science. So let's take a look. Happy beginning of the semester. So when we think about what is vocation, right? So in order for us to kind of understand what this is, we need to know and kind of analyze the intersection of what your talents are and what is the world's greatest need. And so, sometimes people will say their vocation is their job, and that can certainly be true. I definitely personally feel like my vocation and my occupation are very aligned. So I think that, my job as a professor is to connect with my students and provide them with mentorship to help them achieve whatever their goals are. So I certainly feel like that's a huge part of my identity and who I am. And I think I'm good at it, right? So again, when we think about what does vocation mean, we want to try to figure out how can our talents help other people, right? And I think that that probably hits home really, really well for students that are wanting to go on to a healthcare profession, right? So again, we'll talk about this in our discussion post, but essentially, I would imagine, and again, we'll find out more as we move through the semester, but I would imagine a lot of you want to get into healthcare because you want to help people. So we think about health science, we're encompassing a wide range of professions that are aimed at improving patient care, could be public health, could be something within medical research. So again, think of this as more than just a job, but more of a mission to how can you serve and contribute to the well-being of others? How can you best help those around you or those in need? So again, when we think about understanding vocation, I want you to kind of take some time and reflect on what does vocation mean to you and how does this specifically differ from a potential job or a career. And so this will be one of the questions that I'll pose to you in our discussion post, is kind of trying to separate those, but also mesh those concepts together in terms of understanding, what this might look like for you individually or for you personally. So when we think about the importance of vocation in health science, why choose a vocation in health science? So again, what are some of the common reasons that students go down this path? Number one is making a difference. Health professionals will play a crucial role in improving lives. So again, we think about that application piece of what you do. You're directly influencing people and you get to see that, right? You get to see the impact that you make on them. Number two, job satisfaction. So many healthcare workers report high levels of personal fulfillment. And again, I think, if you work in physical therapy, for example, wow, how cool is that you get to see somebody straight out of an ACL tear to all the way to return to sport. Or, if you're working in cardiac rehab, for example, you get to see somebody who just experienced a heart attack and now we're going to prepare them to return to their activities of daily living, right? So again, I think in a lot of these careers, we see a lot of personal fulfillment because you get to see this through. You get to see kind of an end product here. We get a diverse amount of opportunities from clinical care to research, public health, administration. Health science is pretty vast in terms of what you can do in this field. So I think that that's really neat. You don't ever have to feel like you're going to do the same thing every day because there is so much diversity in terms of what you can do within this field, but also even diving deeper and looking at like nursing, for example. Wow, there's so many different things you can do within that one field with that singular degree. So lots of good opportunities there to keep yourself challenged. And then lastly, job security. So healthcare is a growing field. We've got a strong demand for individuals in pretty much every realm of health science or of healthcare. So that should be very reassuring for you in terms of security and creating a stable lifestyle. The job market is excellent in this field. So when we think about our personal strengths and interests, again, I want you to kind of reflect on how do you identify them and their importance in choosing your vocation. So I want you to, again, we'll talk about these and kind of apply these in the discussion section for this class. But essentially, I want you to kind of think about your strengths and your interests and how did that help you to kind of narrow down what it is that you want to do or what it is that you want to achieve within your life, right? So again, kind of understanding how those factors might play into you choosing your vocation. So what are some of the key areas? So again, I think by the time you are taking this class, you're probably pretty set in terms of what it is that you want to achieve within health science, but I do think there is certainly value in understanding some of these other branches of health science as well. So I included a little bit of information about some of the different careers your classmates might be interested in. So we think about health science careers, clinical healthcare, so thinking like physicians, nurses, dentists, applied health professionals like a physical therapist, occupational therapist, radiologist, those would all be examples there. Medical research, so again, thinking like biomedical science, clinical researchers and lab technology or lab assistants, and then public health, so we can look at epidemiology and health science educators, and then health administration, so understanding healthcare management, analysis, and then also healthcare consultants. So what are the attributes you need to be successful in a vocation in health science? So I kind of just picked 5 that I thought were really important, kind of based on my research related to health science, and what are kind of some of those commonalities that we might see across multiple branches of the health science or healthcare fields. So number 1 is compassion. So again, having empathy and understanding are key to providing excellent patient care. And again, I think a lot of us go into these fields because we want to help people. So having that compassion and empathy for understanding what a patient might be going through, even if we've never been in that situation, right? Trying to understand their viewpoint and how they might be feeling, and how can we best help them to feel heard and to feel supported by you. So having that compassion. Number 2, commitment to lifelong learning. So medical advancements will require continuous education. So kind of being a lifelong learner, right? Committing to continuing to move forward in your trade. So again, there will always be new rehab treatments. There will always be new technological advances as it relates to equipment maybe, or filing systems, or billing, all of those factors. So making sure that we are committing ourselves to lifelong learning so that we can best serve our patients or the individuals that we're going to work with. Number 3, resilience. So the ability to handle emotional and physical challenges in the healthcare setting. And again, I think there's a lot, right? Again, if you're working with low income individuals, or you're working with people with chronic disease that aren't going to get better, right? That can be super challenging. And how do you handle that emotionally and not take that home with you, right? So how can you manage your emotional stress and your emotional energy so that you can maintain a healthy work-life balance in terms of, it's a hard line to manage how much you care about your patients and how much energy you can commit to that versus, being able to still live and enjoy your life as well. So again, trying to maintain that work-life balance will be a major challenge, I think. Number 4, ethics and integrity. So setting high standards of ethics and decision making and patient care. So again, doing the best we can to do the right thing, right? And again, I think, with all sorts of challenges with insurance and billing and, short staff for healthcare providers, like there's a lot of ethical considerations that we need to make sure we're understanding and doing the best that we can to maintain some high standards. And then lastly, collaboration will be really important when working as part of a multidisciplinary team to achieve optimal outcomes for our patients. So what are some steps that we need to take in order to pursue a vocation in health science? And again, a lot of you have already done many of these things, but there are certainly things that we can continue to work on and continue to allow ourselves to grow. So number one is explore interests. So identify which area of health science is most interesting to you. What makes the most sense to you? Is it the clinical? Is it research? Is it public health, etc.? And then if you're choosing clinical, is it occupational therapy? Is it physical therapy? Is it PA? What are those options looking like for you, and what seems to be the best fit? Education and training, so pursuing relevant degrees. So again, that's probably your next step in this journey. If you're taking this class now, I would assume you're kind of thinking ahead in terms of what it is that you want to achieve in terms of graduate school or schooling post-Loris. Internships and volunteering. So again, hopefully you'll get some experience with that throughout this class, where you can gain some hands-on experience in some of these healthcare settings. Certifications and specializations. And again, this can occur maybe before or after you have that kind of terminal degree that you need in order to work in health science. So again, this could be like a CNA, or it could be some sort of specialty that you do above and beyond your BSN, or whatever career path you end up going down. Networking, so attending health science conferences, seminars, and engaging with professionals in the field to allow us to continuously learn, so being those lifelong learners, but also create connections that are going to allow us to have more opportunities potentially in the future. And then lastly, stay informed. So keep in touch with the trends, whether that be within healthcare, within disease, pharmaceuticals, those types of things, technology, policies, insurance, all of that stuff, whatever applies to you specifically based on, kind of what you're doing within your field. How can we stay informed and make sure we can provide the most sound information for our patients? So what are some challenges in the health science careers? Number one will be the emotional demands. And again, we kind of touched on this in a previous slide, but understanding how to deal with patient suffering and death can be super, super challenging. And again, it's a matter of managing or trying to manage those emotional demands with your life, right? So again, this is your job and hopefully it's your vocation, but also you're going to have a family. You're going to have, your own hobbies, your own things that you want to do outside of your workday. And again, trying to manage our emotional energy so that you're not spending it all at work, and then you don't have any left for your kids or your spouse, or those hobbies that you enjoy doing. So again, trying to understand how to package that in terms of a way to kind of manage that. Physical stress, long hours, irregular shifts, and the physical toll of patient care can certainly be challenging. Burnout, high levels of stress, and emotional exhaustion are very common among healthcare workers, and again, probably highly linked to both the physical and emotional demands of the jobs. Fast-paced environment, I would say that can be both a pro and a con, I think, for these careers. So we need to make quick decisions under pressure, and some people like that. Some people like that type of energy, that type of environment. And then ethical dilemmas. So again, healthcare professionals will have to make some complex moral decisions based on what's best for their patient. And insurance isn't always in the corner of that person, right? So again, insurance can be really, really challenging in terms of creating some of these ethical dilemmas for our patients. Rewards of being in the health science careers. So you can make a tangible impact. Helping individuals and communities improve their health and quality of life can be super rewarding. Personal fulfillment, many healthcare workers will find a deep sense of purpose in their daily work and being able to help and provide for others. Diverse career paths. So again, you have lots of opportunities for growth and specialization, and then global opportunities. So health science professionals are needed worldwide. So if traveling is something that's interesting to you, there are certainly going to be opportunities to do that as well. So I alluded to this previously, and I want to kind of touch on this just a little bit when we think about work-life balance. So how do we maintain this while pursuing a vocation? Because when you are passionate about something, you want to put all your energy into it, right? You want to do it to the best of your ability. But in order for us to kind of maintain our energy, to be able to spread that in the way that makes the most sense for you, we need to understand how to prioritize our life versus our work. So setting boundaries, so we want to establish clear boundaries between work and personal time. Prioritize tasks. So again, try to do your tasks in order of importance. So focus on your important tasks first and then kind of move from there. Take breaks. So again, take breaks from work and really kind of check out. Exercise is a great way for you to kind of manage stress as well. Quality time, so spending quality time with your loved ones, when you're out of work, that's important. Unplug, so disconnect from work emails during personal time and kind of allow yourself to live in the moment, right? So be mindful of those factors and try to really, embrace the experiences that you're having. Okay. And then self-care, take time for self-care activities, do what you enjoy doing and make sure that you make those things a priority. It's easy to push off things like I love getting pedicures, right? And if I don't prioritize it, I'll go 5 months without getting one. It's like, gosh, if I would just do it once a month, I would feel so good. That would be such a good thing to do, right? So make sure you're taking time to do some of those self-care activities, whatever that looks like for you. So what are the market trends? We think about current and future job market trends and how this could affect our vocational choices. Again, I'm truly convinced that I could have been happy in a lot of different careers. So I hope that maybe takes a little bit of pressure off for you. I think sometimes we think like you got to find the one thing, the right thing, right? And while I believe there's maybe a lot of wrong choices for me, there's probably quite a few right choices in terms of providing me with that vocational satisfaction. So don't feel like you need to be pigeonholed into one particular specialization within the health science field. Like there's lots of ways in which you can feel that you're making a great impact. So again, do keep in mind that this is a choice, right? You can choose what you do with yourself and how you contribute. So a couple of factors to kind of think about. So we've got a growing demand in healthcare. As you probably already know, our aging population is increasing in size. So as a global population ages, especially in developed countries, there's an increased need for healthcare services, particularly for those geriatrics. So think long-term care, chronic disease management. Okay. It's projected that in the US by 2030, all baby boomers will be older than 65, creating a significant demand in healthcare workers in long-term care facilities, home health, elderly care services. So think like nursing home, assisted living, those types of settings. Also chronic diseases. So we've got a rise in chronic disease such as diabetes, heart disease, obesity, and they're going to continue to grow. So we're going to continue to need healthcare professionals to help manage, prevent, and treat these diseases, whether that be nurse practitioners, PAs, dietitians. All of these individuals would maybe have a hand in kind of helping with these chronic diseases. As we are continuing to progress from a technological perspective, there will be a growing demand for technology integration. So telemedicine, this is kind of interesting. So during COVID-19, this accelerated so that we could do this thing called telehealth. So where we're communicating with patients without actually having to physically see them. So being able to provide care through these digital platforms. Health IT and data science. So as healthcare systems adopt more electronic healthcare records, we want to have more information about the data. So data analytics and the need for health informatics, data science, and health IT specialists. These areas are going to continue to grow as well. AI and machine learning. So AI is kind of freaking nuts, honestly. It's being able to be applied to diagnostics. So again, being able to provide us with information about disease and diagnosing certain elements of disease, pathophysiology, things like that. Absolutely crazy to me. So professionals that are skilled in AI will be needed in order to kind of make sure that we're doing a good job in this field. So roles in medical imaging, clinical decision support systems, and AI development for health are rapidly expanding. So again, kind of applying both technology and the concept of healthcare into a field would be kind of cool. Expansion of our allied health professions. So again, we're thinking like physical therapy, occupational therapy, athletic training, radiology techs, speech and language pathology. So these are all increasing as well due to their roles needed in patient care, rehabilitation, and diagnostics. So the Physical Therapy Association forecasts a robust growth in physical therapy careers over the next 20 years. And again, I think that it's important to note that part of that is, I would say a large part of that is due to this increase in the aging population. So again, we think about PT, we're working with geriatrics here. So again, seeing an increase in that number of populations will result in more physical therapy career opportunities. Mental health is another area. So mental health professionals, an increased focus on mental health has led to a surge in demand for psychologists, counselors, therapists. Again, we've got a rising rate within the US for anxiety, depression, substance abuse. Without getting into it too much, is there a rise in these issues or just a rise in people talking about them? I can't answer that, but I think we definitely need more people working in this field. So again, an increased need for those therapists and counselors will continue to grow. And again, that's all settings. That's not just geriatrics. That's elementary school and on up. Nursing shortage. So the US and other countries face significant nursing shortages due to an aging workforce. So again, as those baby boomers are kind of phasing out of work, we are seeing a decrease in number of nurses that we have. However, the employment opportunities are growing. So we're looking at a decrease in the number of people that are working in this field, but an increase in need by about 6%. Advanced practice registered nurses, such as nurse practitioners, nurse midwives. This area is also growing as well to help us to fill gaps in primary and specialty care, particularly in like lower, like rural areas. So places where there's not a whole lot of people, it's hard to have a specialist in some of these more rural areas. And so it's really important that we have some of these maybe more specialized nurse positions available to kind of fill those needs. Nurse educators. So again, because we have an increase in demand for nurses, we also need more educators to help and train them. We are also seeing a shift in terms of a rise in preventative and holistic health. So wellness and preventative care are also on the rise. And as we shift to preventative care to reduce healthcare costs and improve quality of life, there's a growing need and demand for wellness coaches, nutrition counseling, exercise physiologists, preventative medicine. Let's throw in personal trainers and group exercise as well. We can also think about holistic health professions. So again, integrating medicine, acupuncture, chiropractic, and maybe some alternative therapies are gaining in popularity as patients seek non-traditional approaches to healthcare as well. So to kind of summarize, what are some of the key sectors of healthcare that we see growth in professions for? Honestly, all of them, but I made a list anyway. So we see healthcare management and administration. So some of those administrative roles, nursing and kind of everything within that. So advanced practice nurses, like we said, the nurse midwives, nurse educators, and just general BSN nurses we need. mental health professions, so psychologists, counselors, therapists, social workers are all in high need as well. Our allied health professionals, so again, a lot of these outpatient therapy types of things, so occupational, physical, athletic training, occupational therapy, physical therapy, athletic training, radiology, radiology techs, and medical lab techs as well. Phlebotomists, let's throw them in the mix here. Health IT specialists, and then we think about public health and global health, thinking about epidemiologists and people working in a public health field. Maybe that's global health experts as well, kind of focusing on disease prevalence, and maybe even, thinking about prevention of disease and how can we help our communities become healthier. We mentioned networking as an important element to allow us to kind of push ourselves forward. So we think about networking and mentorship. The role of networking and finding mentors in vocational success is important. So this can help us to open doors to new opportunities, collaborations, and projects. So again, building a network will provide you with the support system of professionals that can offer you advice and guidance, and also help you to develop and improve your interpersonal and communication skills. My honest opinion is the more specialized you are within your field, the more important it is to have mentorship and networking, because it becomes challenging for you to just walk down the hall and ask somebody a specific question if they aren't in your specialty, right? So being able to reach out to people that are, in that niche specialty can be really important to helping you to move forward within your career. In conclusion, the power of vocation in health science is really strong, right? So a career in health science isn't about making a living, it's about making a difference for our patients. And health science will offer us many different opportunities based on the individual's skills, interests, and passions. The vocation of health science is rooted in the desire to help others, contribute to well-being of society, and continually grow as a professional. So I hope that this gave you some good introductory information. And the next thing I'd like you to do is move forward to the discussion posts. And I want to find out a little bit more about you and understand your why and how we can help you to mesh your vocation with your job here within health science. So that's it for today. Hope you have a great day. And as always, please reach out if you have any questions.